Hi, everyone, and thank you so much for joining yet another episode of the Health IT Playground. And for those that have never been here before, the Health IT Playground is here to educate current and future health IT professionals about the field because, hey, health IT is hidden and I want to get it out to the world. And so today I'm excited to have someone here that knows not only about quality assurance, not only about privacy, ROI. She is the lady. She knows her stuff. And I'm excited to have her here today. Her name is Neelam Sharma, and I'm going to have her actually talk more, give a little introduction about herself before we dive right into this interview. So thank you once again, Neelam, for your time. And I'll just give you some time to share who you are to our audience today.
Hi, thank you. Thank you for the time you provide me for this. I am Neelam, and currently I am working with HCA Healthcare as I'm a specialist. Before that, I was working as I'm coordinator with the HCA Healthcare, and my primary role there was to make sure release of information process was done timely, and we are making sure customers get what they need on time and the way they need it. Besides that, I was also involved working as a co-privacy officer, where I have to make sure our hospital units and clinicians are compliant with HIPAA privacy law. I make sure like nothing is shared unless it is necessary, and things like that. And on top of that, my main role was making quality assurance regarding documentation. I communicate with providers regarding the requirement we have from like Joint Commission or CMS regarding reimbursement or quality purpose. So these are the main roles I was doing there. And currently, I am also doing like IT management in degree, so that I kind of go into like project management or work on the projects that related to healthcare that will make impact on healthcare outcomes. So this is what I am doing currently.
And as you guys can tell, she's doing a lot, right? So I had to have her on the show. I'm very excited to have her here. And like my audience knows, I always start off with the same question. How did you learn about health IT? We all have a story. What's your story?
Yes, it started from when I moved here in USA in 2013. I moved here from Canada, and when I first tried to get healthcare for my kids here, I felt that it is totally different from what we experience at Canada. And I was like kind of confused with this difference, and also want to know the reason for this difference. So I started my research right there. And during my research, I learned about totally new terms or new thing that is medical coding and billing, which was like intriguing for me because uh, I also learned about the profession called medical coders who can work from home. And during 2013, concept of work from home was quite new. And as a mother of two small kids, I was really attracted from that concept and started digging more, and found out about the health information management profession, which was working as a bridge between clinician or provider and the patient. And I was really impressed by the impact these professionals are making in healthcare outcomes. So I decided to pursue my career on this, because I was thinking about like I have to choose a career path for at a new country. So that was the starting point for me to choose healthcare IT as my career path.
Okay, so it all came from moving from
From
Canada
Yeah.
coming here and realizing, wait a minute, this is not how things roll in Canada. What
Yeah.
is the difference? Like, why is it different? And that curiosity led you into now your career. And
Yeah.
how long have you been working in health information management?
Yeah, I started my coursework during 2015 or 16, because I did my research, and since I just moved and we have like to settle down and like manage about the finance, how to like finance my training. So it took a while for me to like get into the college. I joined college, and during 2016 I joined for go for the associate degree, thinking that I will take like a certificate on like coding certificate like CCS or CPC. However, during my coursework, I didn't like quite like coding itself, so I decided to go for the health IT, and I sit. Yeah, it. I think I sit for RHIT during 2020, and I got my first job at HCA Healthcare as a HIM specialist on 2020. So it's like more than 3 years now.
And how has your experience in the job market been? So you had luck of getting your RHIT and then being able to get a job. So how has your experience been in the health IT market?
To be very honest, it was quite frustrating initially because I had like difficulty getting my foot into this career because it was totally new, and I was in totally new country with no experience here. And I wasn't able to transfer my experience from back home, and it was really a big struggle. I was there on social media like Twitter and LinkedIn, now X and LinkedIn, trying to network with the HIM professional, health IT professionals, trying to expanding my knowledge and trying to get suggestion on the like best strategy for career switch or start over in a new country. uh, I was like starting to totally new career in a new country, so it wasn't easy before. But I took every suggestion I received from those HIM professional with whom I was able to connect. I volunteer at local library, I children's homes. I was there for like almost every parent teacher events at school, which helped me to develop my communication skills and also language, because English is not my first language. So I have to like improve those skills. That really helped as well. And those experience and those connection helped me to get an internship at Compasses Hospice as a medical record intern.
Okay.
And this provided me the experience which led me to my career start at SCA Healthcare as an SIM specialist. So journey was not that good before, but I mentioned my like consistency and work for it in different ways, and I am here now,
Yes. And
still trying to do more.
yeah, yeah, and I'm so happy you said that because whenever I get on LinkedIn, I see posts of people saying, "Hey, I can't find a job, health IT, like what is this? I have this degree and now I can't even get my foot in the door because I don't have any experience." So you kind of spoke a little bit already on your recommendations,
Uh-huh,
networking with other HIM professionals to
uh-huh.
find opportunities. Is there anything else that you would recommend for those that are currently right now trying to find a spot in this industry? What's your tip for them?
Yes. Since you say like those who are like already have a HIM degree and were not able to find the job, I will say like try to get certification, because that is the suggestion most of like the HIM professional provide me. At least have one start with one certification, sit for one certification exam that you want to pursue your career in. Like I sit for RHIT, maybe you can sit for RHIA, also SIMS provide several certification, or maybe coding certification. Where do you want to start? Based on that, go with the certifications. And also you need to like learn the skills that are used in like health IT, like maybe analytics, or trying to like see how the EHR or EMR tools work. Because like when I started my internship at Compasses Hospice, I was working like on the paper record. I don't have like that access to the EHR or EMR tools they were working. But I talked with my volunteer coordinator and ask her if I can like have like demo or training session, if she can give me the training sessions on how these tools works. And so she give me the access to like 2 or 3 hours, yeah, EHR EMR tools they were using, like training for those. And that really helped me to find out like how the EHR or EMR tools really worked. So those kind of small things really help. And I already mentioned that networking with the similar professionals is the best thing you could do with this. And another things that come along with networking is that try to find mentor, and they will help you a lot. I'm still having mentorship I'm still in mentorship program. And during this journey I had like several mentors who are like directly helping me as a like mentor, meeting me with me like on monthly basis or weekly basis, or someone are like just casually giving me suggestion on do this and that also count as mentor, right? So these are the things I will suggest for those who want to get into the health IT field.
Yes, I love that. Mentorship is so important. We all have mentors. I have a mentor. You have a mentor. We all
Yeah.
need
And
someone.
now I'm ready to become a mentor for someone.
Oh,
I,
yes.
I can
Yes.
do that if I am like I would be any help.
Yeah.
Just
And
reach out for just try to reach out, like don't feel shy. Yeah, I am kind of shy person, and I am not comfortable with reaching out with like new people, but I have to do that because I want to like get into the profession, and I want to do best.
and for those that are like, oh, I want Neelam to be my mentor. What are you looking for in a mentor? Because it takes a lot of your time to mentor someone. And so I want to make sure that you also have someone that you would align with. It has to be a partnership, right? So what are you
Yes,
looking for
yes.
in a mentor? For those that are wanting to pick her, listen closely. What are you looking for in a mentee, actually, a mentee?
But for mentee, like I will say they should have like that interest on learning, and they should be like honest about the things that they are trying to achieve. They should be like clear about what they are trying to get into, or those are the things I would look for a mentor. They have like that interest on learning and moving ahead. I will say like growth mentality. I
Yeah.
think that is something. And also I would like to add like they should have that ability to like take the suggestion on positive way, or like sometimes like it's not only the like good suggestion, sometimes maybe like mentor have to criticize on what they are doing, so they should have that ability to take it positively.
Exactly. Feedback. Yes, I get feedback all the time. It's
Yeah.
you have to be able to receive
Yeah,
good
I would like to like I would change the word like feedback. Yeah.
yes.
Sometimes that might be something that we really don't want to do, and we may be like try to block that. But I think the thing is like don't keep it like don't take like hard feeling on those things sometimes. Yeah. You just have to like try to make it positive, make it in the positive way.
Yes. And so if anyone here watching right now is interested in being her mentee, I will have her information in the description so you can contact her. I'm sure she can't take 1,000 people, but definitely reach out to her
So,
if you would
first
love.
come first, first come first serve.
First,
This.
yeah, okay,
I'm
guys.
sorry about that. Like I just messed up.
So watch quickly, okay? So talking about all of these things, what do you do as of right now on a daily basis in your role? So first off, what is your current job title? Because you've done so many things.
Yeah, I am a time specialist. Actually, like I should say, I am in a kind of career break because I'm trying to transition to the project management area or more of health IT area. But still, I am a PRN with them, and I go like to work sometimes. So my daily role is now making sure, like of the, as I said before, like as quality assurance is my main role. So I assure that quality of the documents are CMS requirement. And I try to like maintain the standards. If not possible to exceed, I try to exceed, but if not possible, I try to maintain that quality standards. And also another is like I have to communicate with provider regarding like those quality requirements. And also sometimes I have to like communicate with the team regarding these things.
Okay. Okay. So someone that would want to do the job that you just described, they would need to be able to, I'm assuming, communicate well, be able
Yeah,
to
communicate.
deal with a lot of documentation and
Mhm.
be able to take note of details.
Yeah.
Okay.
Yeah, that detail is the more attention to the details is the most important thing that we need because you know, things need to be like we have to check like for the small missing things. So and communicate with the provider that hey, we are missing this and we need this by this time. So time constraint and attention to detail is something that you really work on these kind of roles.
Okay. Now, just to switch gears a little bit, I had the opportunity to see you posting and posting and posting all of these exciting moments at HIMSS. Okay.
Oh yeah.
So, so I know for a fact that you were there. I didn't get to go. I would love to go next year. But
You
just
should. It
to
was
share,
my first experience and I am like loving it.
yeah, how was it? Tell me the highlights of your experience at HIMSS this year.
Okay, so it was like I was there as a program assistant for HIMSS itself. So HIMSS have this amazing program where they allow students to work for them and also experience the learning opportunity that HIMSS provide and also connect with the all those health IT tech like exhibitor at the exhibition hall. So it's like you get a lot from there like working experience, education sessions and keynote speaking that will like help you to boost your knowledge, and then also networking and also learning about the companies that you may want to work in future. So it's a lot of things that you are getting from him.
So
So yeah, I would love to go like next year at Las Vegas. Let's see what happened.
yes, I want to go. It is Las Vegas next year. I did hear.
We
I did
should
hear. I want to
collaborate and go
gamble, but
together.
I will go to the conferences. So you obviously are a member of HIMSS. Are you also a member of AHIMA as well?
Yes, I am the member of AHIMA. Actually, I get the membership of AHIMA when I was doing my associate degree at LCC. See, because one of my professors suggest us to be the member of professional organization, and but for him, I was like I became a member quite late. It was like on 2022, so.
Okay, perfect. So I have
And
two.
also like in addition to that, I am like currently we have like chapter state local chapter for the hymns and I am the member of local chapter nation's capital area,
Okay.
and we have like monthly meeting. and also they have also like very good mentorship program there for the students members. So
Okay, so
I'm
mentorship.
the part of that program right now because I'm the student for like graduate student for IT management. And if anyone who are located in Northern Virginia area, if they want like to look, they are looking for anything like that, they can join like NCA chapter and also look for the mentorship opportunity with them.
Okay, so in conclusion, guys, AHIMA has great programs. There's mentorship programs. If you're in the nation's
HIMSS, that's like
HIMSS,
HIMSS, not the
HIMSS,
HIMA.
okay, well, HIMSS,
HIMSS NCA chapter.
yes, if you are in that area, and what city is that? Which state would they need to be in for that?
Uh, the one thing I'm not totally sure, but the only thing they need is like you are HIMSS member or you are the student, current student.
Okay, okay. And so if you qualify for that, then definitely check it out. As you can see, she's a member of both. So you don't have to pick one. You can be in both organizations and still gain some great information. So that's helpful. Now, my question for you is, where do you see health IT going in the next 5 years? Like, I'm sure you saw a lot. I'm sure AI was ringing.
Yeah, I was going to talk about it.
Yeah, AI, I'm
Yeah,
sure
AI was everywhere. I was like there in a health IT summit couples of months ago at Bethesda, and there was like lots of IT things like session going on, and I kind of like figured out it will be same in the hymns, but whole it was like to the whole next level. We have like AI in everywhere, and the most important thing like I was intrigued by was like there was a session at HIMSS where it was like behavioral health practitioners, two of the behavioral health practitioner from Chicago, one of the Chicago hospital. They were like talking about how they are trying to use generative AI for like some psychotherapeutic like session, and I was really amazed by to know that like uh, patients are more comfortable asking question or talking about how they feel or their thoughts to the uh, Gen AI tools rather than the like person itself, because they don't have fear of judgment or fear of like getting their information like to sharing their information to someone that they know. And that was really a like kind of situation for me.
Yeah, yeah, yeah.
Yeah, so I think like as everyone said, AI is the technology, so human need to be there to run the technology, right? But yeah, those kind of technology like AI or any other like automation technology or like development technology, those help us like to make our output better. But like we are like human factor is will be always there, but we can like our productivity, we can improve boost our productivity, or like maybe the accuracy, we can use those tools and techniques for our product betterment of like healthcare outcome or for healthcare equity. Because as much as I know, healthcare equity is like a biggest issue in USA, because not all the US people in USA get like similar kind of like healthcare support. So we can use those technology or like tools for like healthcare equity and like making like outcome better.
Perfect, perfect. And there's AI, like she said, in everything. So if you guys want to know where AI is being integrated into, everywhere is, is,
Everywhere, yeah.
is the answer. My final question for you is career-wise, for you,
Uh-huh.
in 10 years, where do you see yourself? I want to be able to watch this hopefully in 10 years and look back and say, wow, she said this, and look at where she is right now. So, where do you see yourself in 10 years?
I'm not sure that would be the situation because, like, I am, I kind of like don't have like faith on planning and getting the things like exactly the way that, because after COVID, it became worse for me. So, but I am trying to get into like project management. So I think I would be one of the experienced healthcare project management professional by then. And also I want to work more on like healthcare policy and regulatory compliance, to like give a successful project which can improve patient outcome. As I say earlier, healthcare equity, make sure about like healthcare equity and improve like healthcare outcome, as I said before. So I would be working on those kind of things. So I think I will be working on something more like on policy side of the thing, healthcare, maybe by the end of 10 years. And also like I am willing to take like leadership roles if like my career path move ahead as I wished.
All right. Okay. Well, I will remember this. It is it will be documented on YouTube to look back on. And
I will go back and check if I said like I achieved and everything that I was saying or I was doing the thing.
yeah, awesome. And just want to just thank you once again for your time. I hope that everyone took something away from here. There were a lot of nuggets in here about the importance of mentorship, about the importance of networking, just understanding that you can go from being a intern trying to get your foot in the door to now working full time in within health IT. So it's definitely possible. Just keep on going, keep on networking, and you can do it. And you can transition and grow as she's now transitioning into project management, which is needed and a great move.
Wish
Any
me a good luck for that.
Oh no, you're good. No, I'm speaking positively into this, and you are definitely going to transition into this. So I have no worries about that. Do you have any final words, final advice that you want to give to the audience before we close today's episode?
I kind of like said everything that I need to say, but just a recap, go get your like certification. First thing is like education. I think like for those who already get their education or have like some kind of background on health IT, if you haven't done it, go get your certification. And network. I don't know how many times I have to say that. And networking means like make it meaningful. It's not just like sending like request and like forget about it. Like try to connect with them, keep that like relationship alive with those who with whom you get connected. And also always keep looking at like how you can improve your skills. There are so many new things coming in the like health IT field, or any profession is like that now. And keep updating yourself, and you will be where you want to be someday.
I love it. I love it. Thank you so much for your time. Thank you guys for watching. I hope this was helpful. If you need to reach out to her, we will have her information that she'll provide, whether it's LinkedIn or email, whatever. She will let me know, and I will add that in the description below for you guys to reach out. She's taking, I'm sure, one mentee. So first come, first serve, guys. And so thank you so much for your time, Neelam. Thank you guys for watching. Anything else you want to add before we close here?
Thank you so much for having me. It was really a pleasure.
Yeah, thank you
Thank
so
you.
much. Thank you. Thank you. And thank you guys for watching the Health IT Playground. And we'll see you guys in the next episode. Like, subscribe, and please share to those that will benefit from this conversation. Bye, everyone.